Welcome to GAAF USA TV. Our featured beneficiary today is Harley Quinn, a 3-year-old baby girl who is suffering from congenital heart disease. She's also one of those babies born during the pandemic. The goal of this channel is to find assistance for the sick and poor children in the Philippines who are crying out for help.
Harley Quinn is the youngest of 3 children and the only daughter of Christine and John. The eldest is 8 years old, the middle is 5 years old, and Harley Quinn just turned 3 last July 4th. She is a member of the GAAF Kids Birthday Club. The family is from Naga City, Camarines Sur. Harley was born at Bicol Medical Center on July 14, 2020. After undergoing a newborn screening test, they were discharged by the hospital as everything looked normal with baby Harley. The only concern the mother had was her chest, which looked a little swollen. On January 28, 2023, during a checkup for Harley's cough and cold, the pediatrician heard a heart murmur and immediately referred her to a pediatric cardiologist. A 2D echo test was ordered, but due to lack of money, it was not done right away. It took the family 2 weeks to raise 3,700 pesos to get the test done at Bicol Access Health Centrum. The 2D echo test was not covered by PhilHealth. They only cover medical expenses when the patient is admitted to the hospital. This was when Harley was diagnosed with congenital heart disease and ventricular septal defect. The cardiologist recommended for Harley to be brought immediately to the Philippine Heart Center in Quezon City, which is the only hospital in the Philippines specializing in the treatment of heart ailments. This hospital is 10 to 11 hours away by bus from where they live in Naga City, Camarines Sur. With unexpected and emergency health issues of Harley, their savings of 12,000 pesos intended for them to get separate housing from their parents was used to bring Harley to PHC. She underwent various laboratory tests such as blood tests, X-ray, ECG, CBC, and again a 2D echo test. The savings were also used to cover transportation expenses, food expenses, cost of medicine, and tests that are not covered by insurance. PHC confirmed that Harley is suffering from congenital heart disease and VSD. They also diagnosed her with perimembranous ventricular septal aneurysm. Harley was recommended for open heart surgery, which will cost 300,000 pesos for hospital expenses and 250,000 pesos for team professional fees such as surgeon, cardiologist, anesthesiologist, and intensive care fee, totaling 550,000 pesos. Harley's mother is a housewife with no income, taking care of the 2 sons and Harley, who is very sick, while the father is working as a maintenance, earning only 8,000 pesos per month. When he accompanies the wife and baby to the hospital, he even takes a leave with no pay. There is no way they can afford this large amount of money. The Department of Social Welfare and Development is only giving financial support of 5,000 pesos every 3 months, which is used for Harley's medications. She has received this financial support twice this year. This only partially covers the monthly maintenance medicines of Harley. In April 2023, Harley's mother started to seek financial help from several party list politicians, different government agencies, radio station fundraisers, and various charitable organizations. It took all her efforts, patience, and perseverance to find resources, write them emails, make phone call follow-ups, and hope for the best results. Fortunately, as of September 2023, the family has been granted guarantee letters from different sources totaling 440,000 pesos. the biggest of which is 200,000 pesos from Senator Bong Go to be approved by Malasakit Center. This amount will go directly to PHC to cover the 550,000 pesos cost of surgery. Harley will likely be scheduled for surgery this coming October 2023. The family is just asking for monetary assistance to help defray the cost of transportation to and from the hospital, food expenses, cost of medicine, and miscellaneous expenses during the surgery.
Congenital heart disease is an abnormality in the heart that develops before birth. There are different types of congenital heart defects. Harley's heart defects are from a ventricular septal defect, commonly known as VSD. She also has a perimembranous ventricular septal defect with aneurysm, which is a rare finding where part of the tissue is weakened and balloons out. VSD occurs as a baby's heart is developing during pregnancy. The muscular wall separating the heart into the left and right sides does not fully form, leaving one or more holes. This abnormality causes oxygenated blood to move back into the lungs instead of being pumped to the rest of the body like it's supposed to. These changes may increase blood pressure in the lungs and require the heart to work harder to pump blood. There's often no clear cause. Genetics and environmental factors may play a role. Symptoms can include poor eating, slow or no physical growth, fast breathing or breathlessness, fatigue, and a heart murmur. A small VSD may cause no problems and may even close on their own. Patients with medium or large-sized VSDs require surgery. Most patients with this condition require heart surgery and close monitoring by a cardiologist. With your help, Harley will be able to get the life-saving heart surgery she desperately needs.
I would like to invite you to become an angel to Harley Quinn. You can be an individual, a group of friends, a corporation, or an organization. All donations are tax deductible. Harley is only 3 years old, but she is facing an open heart surgery, which is a major surgical procedure. There are risks involved, but it is a life-saving procedure she must undertake to fix her heart ailment. Learning that Harley has a heart condition and needs an operation is already overwhelming for the parents. What is more challenging for the family is the financial responsibility they are facing when Harley gets into surgery and into recovery. The family will be needing monetary assistance for transportation expenses, food expenses, medicine, and miscellaneous expenses while she is confined at the hospital and when she gets home for recovery. After surgery, it would be easier for Harley to have new clothes that open in the front. This will bring a little comfort for her in changing clothes. She is also wishing to cuddle new toys while recovering. Toys will help her get through the initial trauma of the surgery. Also, toys play a key role in raising a self-confident, creative, and happy children. On September 4, 2023, Harley started going to Educare 2, where she enjoys tracing, coloring, drawing, and playing with other kids of her age. Her parents see that their daughter is very happy when going to school, and she cries when being stopped. The parents worry that school activities and active play might affect her heart ailment condition. Since money is tight in the family, a monetary assistance would greatly help in the school fee of 135 pesos a month. There are amazing opportunities for Harley at Educare 2. This will give her an environment that builds imagination, compassion, and social and cognitive skills. All monetary donations are tax deductible. Your generosity and compassion will have a great impact in the life of Harley Quinn. It would be a big help for GAAF USA TV if you can click the like, share, and subscribe buttons, including the notification bell so you don't miss any of our future videos. Thank you for your support.